Richard, thank you for talking to me and enabling the church to have a tiny glimpse of what it's been like for you as a GP in these last few weeks. Can you tell me what it's like for you?
Well, it's been an amazingly intense and busy last 4 or 5 weeks. The way I work on a day-to-day basis has changed out of all recognition. Because of the infection risk from COVID, we've actually cut down the number of face-to-face appointments with people absolutely massively. I would say probably no more than 5% of our contacts are now face-to-face. And what's replaced that is telephone calls, probably the majority telephone calls, but also some video calls and quite a lot of use of email. In terms of, for me personally, as one of the senior GPs in our practice, there's been a massive amount of information to assimilate and disseminate, and actually helping the practice to find a way forward to the new working practices. We're all, every member of the team is doing something different now. We have nurses sort of manning the door, taking temperatures when people come in. Our receptionists have had to adapt to a whole new way of interacting with patients on the phone. Everybody's job descriptions have changed. We haven't been at the front line in terms of seeing COVID patients like the hospital doctors, who are doing such an amazing job. I think the priorities in general practice have been trying to keep people's general health worries, the everyday things, ticking over, though there's been a massive reduction in the number of contacts. But also prioritizing, really identifying the high-risk people who've received the government's letter on shielding, and then dealing with the anxieties created by that, and helping to explain things and putting people in touch with sources of help.
That sounds incredibly busy, incredibly tiring, and an extraordinary change in culture, both for yourselves and your staff and for the rest of the population. I wonder, can you see good things coming out of this?
I think the things that I see, which are probably common to what many people would see, is just the way everybody's pulling together, and that's not just in the health service, but that's across the community. Within our practice and within the health service, I think there's an incredible sense of working together as a team, and how working together well is so important. But there's been amazing offers of generous help. We've had equipment offered to us, offers of resource from people who have no close links to us, but and of course the NHS Volunteers scheme, which the government launched, has seen a massive number of people offer help to vulnerable people. So that, I think, is a good thing. I think it has to be good for community, yeah. And I think we all say, actually, the health service and primary care will never go back to being how it was. And there will be good things about the way we're delivering services now, which will enable a limited pot of resource to go round more people. And so there's been a lot of talk about shortage of GPs, and actually some of the ways we're working now will mean that we can help more people.
That's so good for us to know, and it's great for us to hear from somebody who's really on the front line, and be totally assured of our prayers for you, for those of us who can't be on the front line like you, but have you in our mind. Thank you, Richard, very much.
Thank you.